Perfect. So we have our institute, in short, we call it the ISM, where we have the Salutogenesis, Complementary Medicine, and our university is Sri Balaji Vidyapeeth, which is primarily a healthcare university in the south of India. I would like to start off with this very important statement from Plato, where he says that the treatment of the part shouldn't be attempted without a treatment of the entirety. The treatment of the body without treating the mind and soul is a useless waste of time. We have taken this to heart and brought it into clinical practice. I'd like to also acknowledge our K.R. Seduraman sir, our previous Vice Chancellor, who, when describing healing, reminded us becoming whole is what healing is all about. And for us, sir is the one who opened our minds and hearts to Salutogenesis in 2015. Of course, our gratitude to Professor Aaron Antonovsky, the father of Salutogenesis, who has given us this beautiful concept that gives us a focus on the sources of health rather than the sources of disease. And though we all know this, I think one of the very important aspects is that when we talk of the sense of coherence, that it is pervasive. So this is not something that just happens once in a while, but it becomes pervasive. And this is why we are trying to bring about that sense of coherence through our work with the patients who come to the hospital, the students who study with us, the faculty and staff of our university and the local community. And again, we are working towards this because we are looking at holistic health and well-being so that the perceived health, mental health, and quality of life can all be enhanced, as has been seen with the correlations to SOC. We have understood that the importance of the three statements, my world is understandable, my world is manageable, and my world has purpose, or my world has meaning, is what we want to bring to each and every one who walks into our institute. This is what we want them to have when they come into the institute, and when they walk out, this should become part of them. We have understood very clearly in our ISCM that illness and wellness is a continuum. And whereas the treatment paradigm is focusing more on disability, signs, and symptoms, which is the typical medical approach of a healthcare institution, we want to look at a wellness paradigm where we don't neglect the disability, signs, and symptoms, but we are working towards a high level of wellness by enhancing the awareness, educating, and enabling growth through a proactive approach. What is it that enables health? How can our participants reach their potential? And how can they have an opportunity to live their life fully? Because that is what being human is all about. So here we are looking in a medical institution of a changing paradigm from a doctor asking, what did I do to treat illness or disease, to the same doctor asking a question, what did I do today to create health and wellness? So my dear Rudyard Kipling, who was very famous for Mowgli, he made a statement. He said, the east is east and the west is west, and never the twain shall meet. But I always say that, apologies to Kipling, it has been overcome in recent times. Many Eastern healing traditions are slowly and steadily percolating healthcare systems worldwide, especially through our mind-body therapies, where we are focusing on the health promotive, intrinsic connections that exist between the human brain, the mind, the body, and individual behavior. We must remember that health is indeed all about integration. And how do you bring about this integration? Well, on one side, you have the traditional yogi. On the other side, you have the modern medical doctor. How do you bring them together? Communication is vital for this integration. We both need to speak a similar language for that to happen. And so when we talk to our clinicians, we ask them, what are the needs you have as clinicians? They say, can we reduce the crying spells in children? Can we reduce the parental anxiety during immunization? Can we reduce the antenatal and postnatal complications? Can we reduce the pre-operational anxiety in patients posted for angioplasty? Can we deal with behavioral issues in children with special needs? Can we reduce the perceived pain and stress? The other side is also, can we enhance clinical outcomes in non-communicable diseases? Can we enhance healing in neurological illnesses? Can we enhance the quality of life in terminal illnesses? Can we enhance compliance to medical management? That is a big challenge always. Can we enhance the memory in dementia and other such neurodegenerative conditions? And can we enhance the communication and social skills of children? Well, to all of these questions, the answer is yes. And every one of these scenarios I have asked just now, we have done work showing that yes, it can be done. That is the work over the last 15 years at our university. So the question is, how? If yes, how? Well, the answer is integrative medicine. So integrative medicine is based on creating a healthcare system that enhances qualitative and quantitative aspects of healing. We recognize that no healthcare system is totally perfect. But when you bring together two different systems, the traditional and the modern, the strengths of one system balance out the weakness of the other. And we are giving great importance to the humanistic model of patient care. We are working towards the creation of an optimal healing environment that can manifest salutogenesis. So if you look at this journey, initially the journey of integration started with alternative medicine. Now the problem with the term alternative, it is very competitive. So alternative means either you or me. We both cannot be together. Then this grew to the next level where we talked about complementary medicine, that you and me can work together, but still there are some differences between us. And today we are working towards a model of integrative medicine. There is no you, there is no me, it is just us. And this is in line with the WHO concept of TCI, traditional, complementary, and integrative medicine, which we have put into practice at the ISCM. We need to recognize that healing is multifaceted. When we talk about healing, this is different than curing, because healing is becoming wholesome once again. You know, curing is more a pathogenic model. Healing is more a salutogenic model. Here, lifestyle, attitude, relaxation, and breathing, these are important components. And through our work, we touch each and every one of these components. This is in tune with what is known as the bio-psychosocial and spiritual model of wellness, where a lot of work is being done on the biological impacts of therapies. For example, in this case, yoga therapy, which is my chosen field of work. Then psychological enhancement of health, sociological enhancement of health. And we must remember this big circle that has all of them together, the spiritual. So all the four domains, biological health, psychological health, sociological health, and spiritual health, we are working towards manifesting this wellness at all domains. For this, I always like to tell people, you know, in yoga, one of the popular postures is to stand on your head. It's called the headstand or Shirsasana. And here, the me, which focuses on the individuality, has to stand on its head, because when the me stands on its head, it becomes we. And when we have the we have the wellness. The me is very much the individual, the I, that is becoming more of the illness. So moving from illness to wellness, from the I to the we, from the me to the we, by changing the way we perceive our life and the world around us. Another important concept we work on is that relaxation is the key to healing. And yoga and music therapies offer us something which is very rare, a non-pharmacological, safe method of relaxation that can be done by the patient themselves. Now, you don't find too many therapies like that are non-pharmacological, that are safe, and that can be done by the individual themselves, empowering the individual to take care of their own health and healing. And this may be Indian medical system's greatest contribution to modern healthcare. Because when we relax, we facilitate self-healing. And we want to educe what is known as the relaxation response. Because when you educe the relaxation response, you facilitate the healing response. And so in India, the government, over the past decade and a half, has started to focus on our traditional healing systems like Ayurveda, yoga and naturopathy, Unani, Siddha, and of course, homeopathy, which has been part of our system also for a long time. And they call it Ayush, which means healthy life. So at SBV, what do we do? Well, we bring yoga and music therapy services as adjuvant modalities along with the modern medical system at the bedside, in our operation theaters, in the pre and post-op intensive care, in our outpatient services, and even the master health checkup services have a free yoga and music therapy consultation. Each individual is treated with respect, dignity, and provided the autonomy of choice. We offer targeted therapies to focus on individual needs. You will hear both my colleagues, Dr. Meena and Dr. Sobana, talk about patient-centric approach. We are not working on the disease. We are working on the individual who has the disease and helping them enhance the sense of healing and whole personhood. We want to enable salutogenesis. So all our faculty, staff, and students, in fact, the university has a policy on salutogenesis, how that all the staff, the students, and the faculty are given opportunities to manifest it through yoga and music sessions. And we want to communicate wellness, not disease. So as you can see in this image, when our university became a deemed to be university, this was around 2008 and 2009. At that time, there was small yoga therapy unit and music therapy unit run by clinicians just out of their own interest. From the year 2010, the 1st of November was our birthday, we had a center for yoga therapy, a center for music therapy that were headed by yoga and music therapists. And over the next 12 years, did such a amount of work that the university was recognized as a center of excellence in these two fields. And the Institute of Complementary Medicine and Salutogenesis came into being on the 22nd of August, 22. So though the institute is only a year and a half old, our work is about 15, 16 years going on now. So interdisciplinary patient care is our topic we are going to look at. And about 125,000 patients have benefited from these services in the last 15 years. With small group targeted and personalized care, outpatient consultations in the ward, and another 80,000 participants from our faculty, staff, and students and the local community have benefited from general sessions. My colleagues, Dr. Meena and Dr. Sobana, will be describing our experiences in orthopedics, general medicine, dermatology, obstetrics and gynecology, psychiatry, pulmonology, neurology, where we have all these referrals coming in. And we are going to be seeing how this has actually worked wonders at the level of patient care itself. So here we are going to now go into the yoga therapy dimension, and Dr. Meena is going to be sharing some experiences of how this has come in. And she's also going to give you some nice correlations between yoga and salutogenesis, especially the sense of coherence. Over to you, Dr. Meena.
You're muted. You're muted.
Yeah, sorry. So namaste. Without much ado, I feel so wonderful to be among this elite group. Let me start sharing the screen. Yeah. Is it visible?
Yes, but it's not on full slide.
Yeah. Is it okay now?
You need to put it onto slideshow. Yeah, now it's fine.
It's fine? Okay. Yeah. So namaste again. So wonderful to be here. School of Yoga Therapy. Introduction has been given so very well by Ananda sir. And the main focus in School of Yoga Therapy, what we do is like 3 different aspects are there. The first one is for the yoga therapy for the patients to recover from illness and regain wellness, and educating the future yoga therapists, making them competent, and scientifically researching hows and whys of yoga, quantitatively, qualitatively, establishing how yoga can be a preventive, promotive, rehabilitative, and a curative therapy. So we've been talking about yoga therapy. What is yoga and what is yoga therapy? So yoga derived from this root word yuj. Yuj is a Sanskrit word which means to connect, to yoke, to combine, union. So that is the main word. So what is it connecting? All the different aspects of the individual. So the individual has the gross, the subtle, and the subtlest aspects of the existence. So these are all connected together because, while we are walking in the river of life, we tend to get, exposed to plenty of stress and problems. And what happens is that the individual is fragmented. So bringing them back together, putting them all back together into that whole component is what yoga is all about. And this has been a way of life since ancient times. And the other important thing is that it is both experiential, and you experiment on yourself with the practices and you experience what happens, the changes within yourself, and that promotes whatever change that is to be. So by doing, you become a being. That is the special feature, I would say, with yoga and the yoga techniques, the practices. And it is not just the practices, we also have the concepts backed up with the concepts and different aspects of yoga. So it is not just the 1 hour's practice on the mat, it is 24/7 living as a way of life. And what is yoga therapy? It is the process of empowering individual to progress towards the improved health and wellness through, all these aspects of the practices and the teachings in yoga. And now coming to holistic health. Holistic, as we know, it is like being a whole, wholesomeness. That is what a person should be. And we need to remember, that we can see the gross aspect of the individual always. And anything that happens in the gross is immediately repaired. But the subtle aspect, say, for example, the components that cannot be seen with the naked eye, do we attend to it as it happens immediately? That may be a big question mark. Some kind of a disturbance in the mind. Do we attend to it as like you have a small cut in your finger? Immediately you attend to it. So that is where, the whole problem comes in. Because an individual is made up of the different levels of the existence, the physical, mental, social, spiritual, everything put together is the wholesomeness that is happening. And this is a very, very dynamic state. It has to be, attained and then maintained and sustained. It is easy to attain it, and maintaining and sustaining it is going to become a big challenge. What we call as swastha in the yogic parlance. Yogic parlance says swastha means the wholesomeness, the whole being is considered as, when they are united, they are considered healthy and with a wellness. And it doesn't talk only about the absence of disease or only about the metabolic functioning or body functioning being perfect. It also considers the, tranquil and happy mind, senses, and the soul. So all put together is this. And the other important factor we need to keep in mind is the interconnectivity between all these levels of our existence. So a development is happening in one sphere and the others are not equally developed. The parallel development in the others are not there, meaning there is an imbalance there. And the other factor that we need to remember also is a disturbance happening in any one of these spheres is going to affect the whole equilibrium, because each compartment or each aspect of the individual is connected, interlinked, and influencing each other constantly. The connectivity remains within all these dimensions. And so the mind-body connection, as we say, the dichotomy mind-body, that is where the root cause of all the problems, all the diseases that happens to the human beings. And mind-body, when we can reconnect them, promotes a lot of awareness within, which enables us to understand and respect, our limitations, our strengths, and what are the challenges and how can we face them. So this, leads us to make conscious choices, which is very essential. We start using our neocortex also, what we call as buddhi. And how do we do this? What is the mechanism behind all this? The connectivity. So the main aspect is that all the, the breath work is very, very important. Say, for example, you're moving your hands upwards. So how do we do that? You inhale as you move up and you exhale as you move your hands down. So the body work is always synchronized with the breath. So body is there, mind is there, and these two components, what is bridging them is the breath, the prana, as we call it in yoga. Prana is your life force, which is actually connecting all the different aspects of the individual. They are gelled together, made into the wholesome being through the connectivity that happens with the prana, which is more related to the breath work. So as the individual moves from the gross to the subtle levels of existence, we, with this combination of the broad, spectrum of the body and the mind through the breath, what happens is that you become more conscious and mindful. And once the mind is calm, the breath and the mind, they are very much related. They are directly proportional and correlated, if we can say. So breath is calm means the mind is calm. The mind is calm means the breath is automatically longer and calmed and deep. So this leads to the emotions being stabilized. And they are more, balanced. And I don't want to go into all these, the hypothalamus pathway, the hypothalamo-pituitary, adrenal pathways, the limbic attenuation. All these are the mechanisms that happen behind. But once these are all calmed down and balanced, there is a overall improvement in the psychophysiological functioning of the individual. So therapy is a combination of all these factors, as said by, our mentor, our father figure who introduced us, like Ananda sir already said, Professor Sethuraman sir. It is a combination of the intervention that we are giving, Say, for example, now we consider yoga therapy, the tools that we use, all the techniques, along with that, the information about the system that we are using and the faith in the system of the modality that is being used here. So as we walk in this river of life, there are plenty of challenges, plenty of, hurdles that we have to overcome, stressors that we meet. And we are blessed with plenty of resources all around us, the general resistance resources and the specific resistance resources. The general GRR helps us to identify the specific resistance resource that could be utilized in that particular moment, appropriately applying it so that we can face or combat and overcome the stressor of that present moment, and also not leave any trace behind, come out of it completely. So the yoga therapy that is given, the yoga sessions given to all the students, the faculty, the staff members, the administrative members, the managerial capacity members of Sri Balaji Vidyapeeth, this could be considered a GRR, a general resistance resource. And the yoga therapy provided to, the single individuals to address a particular issue is an SRR, which could be considered as that. So we have been able to, break across, open and penetrate the barriers of the religious, the cultural aspects, and establish the fact that yoga is for humanity and it is universal. We've never had an issue as far as, this factor comes in. Never a challenge, because everybody has accepted this and they come to us voluntarily looking for these therapeutic modality. So how are we going to go about it? We have Maharishi Patanjali, who propounded the Ashtanga Yoga for us. He's given us a beautiful 8-folded path. And these are not just the guidelines as to how to make your life more purposeful and meaningful, but it also gives us the tools as to how to go about it. How can we attain that meaning or the purpose in life? Redirecting it towards our health, because ultimately the physical health is also important, which is going to lead to the other components. So as we say, the physical body is the, the deho jiva, deha is an important place where the divine lives. So to keep it healthy, which means make it whole again. So he has given us 8 beautiful pathways, 8 beautiful steps, or anga, as we call it, the yama and niyama, the 10 ethical and moral rules, the 10 commandments, as we say, for maintaining the social health and wellness, and asanas and pranayama for our physical, physiological functioning, the anatomical existence, and the pratyahara and dharana for our mental, psychological health and wellness, and dhyana and samadhi for our spiritual health and wellness. And yoga considers man as not just a single layered existence, but a multi-layered, as given in the Taittiriya Upanishad. So we have 5 different levels of existence, the anatomical and the physiological existence. Say, for example, we have a heart that is part of the anatomy, the individual. But the heart is not just there as a model, right? It has to function. So how does it function? We need the energy for the functioning, which is supplied by the vital body, the pranamaya kosha. The life force, the prana, makes it function. And then the mind, which generates the thoughts, the conscious, the subconscious, which is the manomaya kosha, which helps us to discriminate. This is right, this is wrong. And we analyze. We have the analytical power, make conscious choices, which is done by the Vijnanamaya kosha. And keeping it all together, the level of bliss, the body of bliss, the Anandamaya kosha. So an attempt correlating all these, the concepts in yoga and the sense of coherence. The three main components being manageability. So let us go from gross, like we say, known to unknown is a good pathway, right? It's easier for us to understand. The gross is easier. And then we go into the subtle, the unknown. So manageability, managing everyday existence, we can correlate that with the physical, physiological health and functioning, and that is kept healthy by the asanas and pranayama, as we see, in correlated to the annamaya and the pranamaya, the physiological level of existence and the energy level of existence. The comprehensibility, we need to understand, we need the mind, the components of the mind. Like we said, the lower mind and the superconscious mind. So we put it all together with the Yama Niyama, the 10 commandments as given to us by Maharishi Patanjali, and the Pratyahara Dharana to, enabling us to bring in the Manomaya and the Vijnanamaya Kosha, correlating all these. And once we understand our, everyday existence, what are all the problems we have, how can we do it? Once we understand all these, we get the meaning, we can understand the purpose of living and leading it to the level of bliss. So a mild attempt to correlate all these. So salutogenesis, as we all know, where we focus on the factors promoting health and wellness in an individual. And here, a person having a disorder or a problem is considered to be, more pathogenic. What we have to do is like promote wellness into this person. And with the components of the sense of coherence, we have these three components, which I have tried to correlate it with, how do we do it? Comprehensibility. So how do we go about with the yoga therapy? Once a patient comes in, a participant comes in with a particular issue, say, for example, diabetes mellitus or whatever it is that has been diagnosed by, the doctors, they come in with the case sheets and we have to do the yogic point of diagnosis. So how do we do that? We have a consultation. We have a yogic counseling session with them. So we understand what are the symptoms in that individual that is now present. And then we try to analyze the root cause. Why is this individual suffering from this particular aspect? And what are the symptoms? Why are these present right now? And then we need to understand, as the care provider, we need to understand what are all the resources that we have and what can be applied to this particular person. So like Maharishi Patanjali, he gives us 4 modalities, as we say, Chatur Vyuham, the Heya and the Hetu being covered here. Heya is the symptoms and Hetu is the root cause. So without noting, looking into the root cause, by just treating the symptoms, it is not going to get alleviated. So how do we go about it? How do we go about managing this, all these symptoms and the problems that the individual is facing? So we need to understand the clarity of what the seeker wants to attain, the goal that needs to be set, what is called as hana, and motivate the seeker to follow the concepts and the practices regularly. Like there are a few participants who come and say, it may be as simple as, I want to sleep better. And, there may be some senior citizens who come and say, I would love to, go in a bike sitting behind as a pillion rider, but I want to put my leg across and sit and ride in a bike. Simple things, which is their goal for that moment. And, that these are goals which we try to address also. And then we try to empower through the techniques or through the concepts, through yoga therapy, we try to empower the care seeker through all these, applying all that we can. What are the general resistance resources that can be, given to them, the specific resources that can be given to them, adding in the meaningfulness, the techniques, which are the upaya. And again, to make it whole is when the healing can be promoted. When it is whole, wholesome, it is when the individual can be at ease, the comfort level, pleasant. If they are fragmented, they lose the sense of ease. That means they end up having a dis-ease. So to heal means to bring them or to combine, to reconnect, making them whole. So what is the uniqueness of our work done? As Ananda sir rightly put in, the focus is on the individual. We treat the person and not the symptoms or not the disease. So the therapy is more person-centric and not the disease-centric. And you're not giving therapy, you need to be the therapy yourself. And that is when it is easier to connect, the patient, the client, the provider, the seeker-provider relationship, or motivating them becomes easier. So that is when it happens. And the practices, each and every practice is modified to suit, and it is tailored so that the individual is able to do the practices and they are able to understand what they are doing, they are able to feel. And each and every movement is, we keep telling them to combine it with the breath. Prana heals, right? We also have the statement, Yato mana tata prana. Where the mind goes, there the prana flows. So doing the practices mindfully enables the prana to flow into all these, the problems and the aspects, whatever is the problem in that individual, the prana flows and heals, sending in plenty of energy there. And the other important thing is chanting. Chanting is, we use a lot of sounds, playful methods wherein, we make them enjoy. There's a lot of stress that they are holding, that they are storing, like in the Pandora's box. And that is causing the fragmentation to happen. So chanting is like, they are letting go of all these that they are storing. The burdens come out, all the regressed and suppressed emotions are enabled to let go, sublimate all of them so that you can be the individual. The disturbances are gone. So what are the services offered here at the School of Yoga Therapy? The daily OPD consultations are there, and all the services that we offer are absolutely free. We are not taking any charges for any of the therapeutic modalities or consultations. Whatever it is all free. And that is really thanking, the university, the administration, the management, top down, the chancellor, for really enabling us to do all these services free. And the individual group sessions for the common public, and then individual group sessions for the students, the staff, through the Yoga Abhyasa program. All of them get the component of yoga given to them. All the students, the medical, the dental, the allied health students, the nursing faculty, everybody gets, the pharmacy, school of physiotherapy, everyone, name it, and they have. Like, for example, it is part of their curricular activity. Like, for example, in the nursing curriculum, when they are doing their graduation in nursing, they have 90 hours of yoga as part of their curricular activity, which is assessed. So once they come out as a nurse, they know, like immediately in a case of emergency, suppose they come across a patient whose blood pressure, the hypertensive patient, whose blood pressure is very high. So immediately they make them sit down and they know what to do. Keep your eyes closed, calm down, and then breathe deep. Like you can say, give counts, like stay breathing in 2, 3, 4, 5, 6, out 2, 3, 4, 5, 6. So these are, they have this, they are enabled and they understand what could be done immediately. And, the simple left nostril breathing, exclusive left nostril breathing could be given to such people who are very, very stressed and whose hypertension is high. So all the students who come in, be it the doctors themselves, be it anybody, the first hand thing is that they experience that and they benefit from that. So it is easier for them to, when they go out, it is easier for them to propagate and give referrals to yoga therapy. And Rural Health Training Center of SBB has yoga therapy that is being offered on specific days. And all the rural community people who never can get access to this because they are all, can I say, below the poverty line, economically backward, all the agriculturists, because they work in the farms, and all those rural communities, they have a chance to attend all the sessions. The master health checkups, as sir said, all the packages, post-operative wards, ICUs, and we also have the outreach activity where we reach out to the communities of the region and other places. You can see the nursing people, the nursing trainees. These are the staff and the managerial people. This is our rural health centers. As you can see, the people from the rural communities. These are the nurses and the cleaning staff of SBB having yoga sessions. The trainees, the nursing trainees who are going to become nurses, they are getting trained with yoga. The rural community students, the school going children, they all get yoga. And these are the nurses who get the students, nursing students. And this is the ortho ward, wherein a patient is getting in the OPD, getting treated for the low back pain. This is the psychiatric ward where we go in and offer yoga therapy, and these are the OG wards where, yoga therapy is offered. You can see a pregnant women, having the session there, enjoying her practices there. And this is the neurosurgery, the post-surgery, one of our interns from Australia. So we offer internship programs. I'm sure Ananda sir will be explaining more about that. So she was here, a yoga therapist from Australia, and she was able to strike the chord there with these patients, and the doctors were surprised. How was this person who was, neurosurgery person was operated, could be enabled to sit up, and he was healing so quick. A person who lost his voice was able to speak very, very quickly. So he was surprised and he was asking, like, what is the magic? What is the miracle that brought in this change? Because what they had deemed as he will not be able to do it, he was enabled to do it. So again, the therapy that is being given, where he was able to voice out with the pranava pranayama, as we say, the pronoun, all these, the nada, in enhancing the healing component, spreading the vibratory energies within, and connecting the individual. So that can go on. And this is a stroke rehabilitative a person who had faith in us and who came and stayed with us for more than 3 months. And you can see our, the student in yoga therapy and our instructor working with her personally, and tremendous improvement by the end of 3 months, that she wants to write a book now, yoga therapy, and how it has helped her to come out of all these problems that she was, especially you can see how her left side is affected. And now you see that she's supported with a wall and she can do plenty and plenty of practices. And she is one living example who's motivating plenty of people, all these stroke patients, as they are in that community from UK. And the specialized services, you can see our instructors being COVID warriors, having during the COVID times, they used to go into the wards and give yoga therapy in a PPE kits. And this is a palliative care where we extend our services, the medical oncology where we have the services being extended, the gastroenterology, as you can see, patients with functional dyspepsia being treated, and then other orthopedics, patients with low back pain or any other conditions, the cervical, and then the dermatology. I have to share this, anecdote with you. There's the dermatology ward used to be next to our yoga therapy unit in the initial days. And then, there was a patient who was admitted with psoriasis. She had been branded a non-respondent, and none of the drugs were working on her. And what happened was that she was like pestering the doctors, coming back again and again. What next? What next? They had tried everything. And then, one day they got so pissed off that they said, go to yoga therapy. It's right next door. Go there. And then, like some magic, she started attending regularly, and she had some, she could feel something. And after a week of the yoga therapy, she started responding to the methotrexate. And that, was a barrier which was broken. And now we are doing plenty of stuff with the dermatology. In fact, one of our assistant professors is continuing his, PhD thesis work with psoriasis. And we come up with plenty of findings there also. The diabetic clinic, the hospice, the outreach programs that we have. We specifically focus on the hospices, the transgender community, and the children with special needs. So plenty of work being done out in the community, where the schools, the rural schools, the government schools. This is a mass awareness program. This is a program that happens at the Pondicherry University. So there's a big, huge reach out. And we find that the group sessions are always therapeutic on its own. You can see how the senior citizen, they are all enjoying because, they are among their peers. And there's a beautiful sense of belonging, which is like something that they enjoy. And the other unique, special feature in our school is that we train the special educators who are dealing the children with special needs. So we give training so that they can go out, and the component of yoga therapy is regularly given to them as part of their school activities. And what is the reward? You can see the smile that comes out of them, when they meet you. And once they are healed, once they go out, it's like the smile given speaks volumes. And the other thing you can see, occasionally we get a nice hug, or, the plenty of feedbacks that we get from the participants, and the care providers of the participants who come back and say how normalcy is, regained in their houses, and plenty like that. A few of the case scenarios where we had been able to strike the chord, just a few anecdotal, anecdotes that I would like to share. A young married woman who was very, very disturbed, psychologically admitted here at the hospital. She came in, thanks to the doctor, the psychiatrist, who referred her to yoga therapy. So what happened was that, when the patient is referred to us, the participant is referred, we usually have a nice talk with them, one-on-one talk, give them counseling, yogic counseling. The traditional, the ancient wisdom. When we start doing it with them, we understand the problems that the person is undergoing. We have a long talk, and then only they go in for the practices. So after the counseling session, this woman, went in for the practice practicing the yoga techniques. So before she went into the yoga hall, she threw something into the trash bin. I was surprised. And then, I looked into it, and it was a vial of poison. I was taken aback, and I confronted her. And she said, I had lost all hopes in life. And after this is just another customary visit to a place where the doctor is referring. So after which she wanted to end her life. But now she said, I have got my hopes up now, and I want to retry, give a chance to life. And I can feel the goosebumps, because that was a moment when we realized how strongly you can influence a person. And now, believe me, she is a counselor working in a university, helping enable plenty of students, motivating them come out of the depressions. And she is were there as a counselor. This is another very, very close to my heart participant, an elderly woman who, like we were talking, the goal setting. Her goal was very, very simple. She had her granddaughter's marriage, which was upcoming in a few weeks, and she doesn't have the energy. She's very, very enthusiastic. She wanted to participate in all the, we have very, very elaborate weddings which go on for 3 or 4 days. And she wanted to participate enthusiastically, energetically in all these, events there. And she was lacking energy because of it. She got very depressed. But once we started doing therapy with her, she regained the energy and she was so enthusiastic, participated in all the activities and all the events of her granddaughter's, wedding. Though she didn't live long after that, the final few days were really qualitative and she really lived happily. And this elderly man, a Muslim man who was operated, one lung was removed because of thymoma. And his goal was, when he knew that his end was approaching, he had accepted it very well. And he just said that, when I confront Allah, when after my life, I need to confront him, look into his eye and say, I have lived a complete life, which means I want to do my prayers. I want to sit in Vajrasana and do my prayers. That's the only thing that I'm looking for. And, after 3 or 4 months of regular therapy sessions with him, we were able to do that. And one day you can see, this is the reward that we get. He came to us and said that, I'm so happy now that I'm able to do my prayers. I will definitely confront Allah, very, very happily. And this constantly happens because the students of SBB, the medical students, the dental students, they undergo plenty of tensions and stress that happens there, the curricular activity and, the peer pressures that happens, plenty of targets to be met and everything putting their morale down. And more than that, up to class 12, they are all in their home atmosphere. They're all day scholars. But once they come out into the hostel, they miss their homes. That is again adding to all this. They get so depressed. Along with that, this particular person who came in had suicidal tendencies. But believe me, she is a medical practitioner now. And, she treats so many patients very successfully. That's again, she has experienced the benefits of yoga. And now she refers patients very, very, confidently saying that yoga is going to help. And, sorry. Yeah. The senior citizens, their goal is something very, very simple. We have a person here who was, very dependent, who could not walk, who used to have a walking stick here, if you can see, propped up. But later, after a year of regular practice, he did not depend on anybody. He could come to the classes on his own. He could walk up the stairs and attend the sessions. And slowly, he was not even holding the walking stick, which he came out of. And like I said, the pillion rider and the bike, they wanted to just sit as a pillion rider and go for a bike ride, feel the air on the face. And simple, women tying the sari pins and plaiting their hair, which they could not do because of the arthritis, the fingers being affected. These are the small, instances where I can just recollect a few examples here. And of course, the children with special needs, the close to my heart where I work a lot with these children, we find plenty and plenty of benefits happening. The one thing is that, I can very proudly say that most of our children are going to normal schools now. Of course, not in the level that they need to be, in a lower level, but they can go to a normal schools, which they were not allowed to earlier. And, they are more independent, they are more self-reliant, they are more confident, they are more socially adaptive, cognitive, the understanding is very, very improved. And the parents and the siblings, they come and tell us that these children are so beautifully gelled up with the families that there is so much of peace, and they help with the household chores, the siblings chores, and the aggression is down, the anger is down, the attention seeking devices are down. And we have also found that the severity in autism has reduced. We just completed a PhD thesis work on this, and we have found out that the severity in autism can also be alleviated with this. So you can see, we make plenty of, like joyful practices which can be adapted and which they can do, and they enjoy the practices, and that's it. So yoga is very, very holistic, as we say, trying to combine and, like bring back the connectivity in all the aspects of the individual, bringing in the transformation, promoting, the holistic being to be promoted, and he can become one whole being, start living life with a purpose and meaning to the life. So thank you all for the patient listening. I don't think I have overdone my time. So over to Sobana, ma'am.
Thank you, Dr. Meena. I now invite Dr. Sobana to share about the music therapy work because, there's just so much going on that we love to share. And over to you, Sobana, ma'am. Dr.
Yes.
Sobana.
Yeah, thank you. Can I confirm the screen is visible to you all?
It's not full screen.
Okay. Yeah.
Yes.
Now?
Yes.
Okay. So, greetings. Good evening to you all, to the STARS community. And it's really a delightful and a happy experience for us for being invited to talk in this Apex Forum. Myself, Professor Sobana, the administrative in charge of the School of Music Therapy, Institute of Salutogenesis and Complementary Medicine. Having heard a very elaborate talk about about our institution, the Salutogenesis and Complementary Medicine, and also the role of yoga therapy, I am here to tell the elite audience how we manifest salutogenesis through music therapy. So before we go into our discussion, if you think when music actually entered our life, there is no answer. No, it is a part of our life since the mankind evolved. Each one of you would be using music almost daily for something or other. We use music when we walk. We use music when we work. We use music to celebrate. We use music when we are sorrowful, isn't it? We use music when you don't get sleep. We use music when you're anxious. So music is a part of our life every moment. But how music is used as a therapy? It's a very new concept. And if you look the other angle of music, one music which I like, which is soothing to me, may be irritating to my spouse. And one music which feels good to me today might not get the feeling the other day. And music has got a lot of cultural, ethnical background. So with all these discrepancies, how could music be used as a therapeutic tool as a $1 million question? So we are here, and with gratitude to the STARS Society, let us talk who we are actually, what we do to use music therapy as a tool to attain salutogenesis, why we do it and how we do it, and what are the outcomes we have achieved so far by taking music as a tool. Yes. As it was told by our director initially, let me tell a brief history or the story of our growth, which is around 14 years down the lane. The center was started more than a decade before as a music medicine unit in a small room by a group of clinicians who were very passionate with music, who believed music has beneficial effect. So it was started to give a support to the therapeutic care to the clinicians. So after this was started, they understood that there is a lot of potential for music, and the presence of a qualified or a credentialed music therapist was understood. The presence of music therapist in the unit gave us an understanding that we need to build in, or we need to strengthen the community of music therapists. Then the music medicine unit evolved into the Center of Music Therapy Education and Research after a few years. So this center, adding educational aspect and building qualified music therapists, started expanding its horizon across our university, across the clinical departments, and we started giving therapy in various settings. So slowly and gradually we grew to this level, and it was in 2022 when we merged along with the School of Yoga Therapy into a full-blown institute, a standalone institute of salutogenesis and complementary medicine, which is actually one of the gem in the crown of Sri Balaji Vidyapeeth. It is the only standalone institution in Southeast Asia attached to a tertiary care medical center. So you would all accept if I say that a small egg or a larva has slowly metamorphosed in all its aspects into a full-blown butterfly, and that butterfly starts to move its wing and spread starting from India across the globe. And one proof is being accepted by the Star Society, and we are all here, and we are very, very happy to share what we do here to this society. Thanks for accepting us. And this is the small story behind our what we are now as a part of the Institute of Salutogenesis and Complementary Medicine. So this is the answer for my first question, who we are. Yes. We know that the institute and the school has taken the salutogenic focus, which is looking at the person as a whole, as Professor Meena had said, not looking at the physical aspect, looking at the mental, the spiritual, social, and intellectual aspect. As she has nicely pointed out, it makes the person as a whole. So when you look at salutogenesis, it is not looking at the disease, which normally in the healthcare setting is done by a physician. Myself being a healthcare professional can look into both the angle. So we all look into the disease of a person, not the person as a whole. So I always like this picture. The healthcare system globally looks at the tip of the iceberg. We focus on the tip of the iceberg when it starts manifesting as a disease, when the person presents to the hospital with abnormal signs, when the person presents with pain and suffering. Whereas we don't look at the vast majority which is buried underneath the ocean, which is taking care of the person even when they are well, when they don't present with illness. So why we take the approach is because we want to look at a person as a whole. We want to establish salutogenesis, and that is what is holistic healing. Now, as I said that music, we don't know when it entered our life. Actually, we are born with music. We hear music even before we born, when we are inside our mother's womb, no? The heartbeat and what she sings, everything has come into us even before we are born. I'm sorry. Similarly, there are a lot of musical practices which are ingrained into each and every society. Music is cultural and ethnically ingrained into us. So in India and in each and every society, there are traditional healing practices which are passed generation after generation as a belief system. Similarly, in India, we have a very rich cultural heritage. It is a part of Ayurveda, as Professor Ananda said. It's a part of Ayush. Music is a part of yogic practices. It is not separate from that. The breathing exercises and chanting is also music, so you can't separate it. So it is a part of traditional healing system. A lot of ragas are told that to have, and they are proved to cure many diseases. Particularly a few raga for this disease is there in our Vedic tradition and literature. Whereas, in contrary, there is another system, the modern music system or the music therapy, which started its existence in 1950s in the Western society when music therapists went into the World War veterans and they sang to them in order to help the war veterans who were wounded to overcome their pain. And after that, the World Federation of Music Therapy evolved and a lot of scientific evidences was built because this needs proof, needs evidences for us so that others can take it up. So there are two different systems, the ancient traditional healing system and the modern music therapy practices. So what do we take up in our School of Music Therapy? Yes, we take up both. We bridge the ancient healing system along with the modern music therapy practices, and we don't stop with that. After bridging these two, we work along with the healthcare professionals, and there lies the focus of salutogenesis. So it is very interesting to see that it is an area where art intersects with science. It is the area where music intersects with medicine. I really love the intersection of music and medicine. Here, you need to realize that it could be of different forms. When music becomes a part of therapy, when music in therapy, when healthcare professionals, as I told you, when we started off as music medicine units, few healthcare professionals who had belief in music used music as a part of their treatment. You can't say they are wrong and we can't stop them. So healthcare professionals using music as a part of their therapy is the branch of science called as music medicine. It is actually more of listening experiences. Recorded music is used by healthcare professionals. It is not necessarily they need to be trained musically. It is enough if they have belief in the music, and also so the client has the faith and belief in music. It can be used by healthcare professionals for the wellness of the patient. And this branch of music is music medicine. Whereas music used by credentialed or qualified music therapists following evidence-based or scientific principles as it has been postulated as music therapy. For this, you need a qualified, a board certified or a certified music therapist. Here is where the School of Music Therapy, ISCM, stands out above all other institutions where we create qualified, certified music therapists who are trained in a healthcare university, which happens nowhere. And we are very, very, very proud and happy to tell that our students are trained in each and every clinical department. They just don't learn the theory of it. So, as we saw, intersection of music and medicine has two wide branches: music medicine, where music is used by healthcare professionals, and music therapy, where qualified credential music therapists build a professional relationship with the client and use music for the wellness, for specific goals. Let's see what it is. Yes. So before I go into our areas where we work, little of a scientific validation of how or why we are so confident in using music as a therapy. Let me not go into more of a scientific detail, but few interesting aspects to make us get a belief on the outcome of music therapy. I also very much love this line from a neurocognitive psychologist from the Nimans University, which is a very famous university in India. She says that neurons which fire together wire together. That means two neurons which are stimulated by music get connected. So when different parts of your brains get connected, there is a lot of synapses, which is called as neuronal plasticity. So one effect how music could work is it increases the connection of your brain. It builds the plasticity of your brain. And when you look around you, nothing is constant. Temperature changes, no, there is day and light, weather changes, the oxygen content changes. So our external environment is not constant. Similarly, your body, the internal environment is also not constant. There are a lot of changes. Your wake-sleep cycle is different. Your BP is different. Your oxygen level is different. Even though everything changes, the body has its own ability to bring everything into a balance. Okay, so we try to overcome the imbalance in the atmosphere or the environment to bring ourselves into a balance, which is called as homeostasis. When this balance is lost, the disease sets in. When your sugar level is beyond your normal, you get diabetes. When your BP is beyond your normal, you get hypertension. Very simple, your temperature is beyond normal, you're febrile. So music by its rhythm regulates the bodily rhythm and helps to maintain this homeostasis. How does it maintain? Two mechanisms. One is the nerve, the electrical connections. Others are the chemicals, the hormonal connection. Everything in our body is maintained either by these neuronal mechanism or by the hormonal mechanism. Whereas music connects these two mechanisms, it produces modulation in your psychology, in your neurology, in your endocrinology, and your resistance, the immunology. So the new branch which encompasses everything is the psychoneuroendocrinal. And actually there is another psychoneuroimmunological modulation by entraining the rhythms by various neurocognitive mechanisms. So it is a whole science behind music. It acts on each and every cell. Actually, our body is like an orchestra and the director is the hypothalamus. So music directly goes and hits the director who controls the entire orchestra so that everything is in pace. So with this, let's go into what we actually do in our center. Yes. So finally, having understood who we are, how we started and how we are now, why we do this, because music has this much of potential. Let's just see what we do. Having understood the potential of music, we take music as a therapeutic tool. We integrate or we bridge the ancient system with modern music therapy, which is structured and evidence-based. And we don't work standalone. We work as an interdisciplinary team along with the healthcare professionals so that we integrate music into mainstream healthcare. As our director said, it is an integrative medicine. It is not alternate. It is not complementary. It is, of course, it is complementary, but it is integrated into the mainstream healthcare. But above that, as Professor Meena has said, we embed music therapy practices for educational goals. It is in one side building music therapists, the other side building the academic excellence of healthcare professionals. And then we use the innovative music therapy practices to empower the underprivileged so that the entire community, the entire society around us is taken care. And finally, salutogenesis or wellness of everybody is achieved. So this is what we do or we aim to do. And let's just go micro step by step what we are actually doing. Yes. So before we start, as it was told by the previous my colleagues, like yoga therapy, music therapy is not disease-centered. It is person-centered. Now, there is a lot of talk in the Western community or globally about personalized medicine, isn't it? Actually, music therapy is person-centered. Like I told you, what music I like may not impress even my daughter or my spouse. Then how could it impress all the group of patients? And music, which is therapeutic in the Indian context, might not be in the other context. And music in one situation may not be therapeutic in other situation. So a credentialed music therapist builds a relationship with the client. And how does he set goal is very important for all of us to know. So the entire music therapy process doesn't happen just like that. I get a patient of hypertension, I give him this music, you hear, you will be better. It's not like that. It is a stepwise process. We get either patients on their own and mostly referral from healthcare professionals. And everybody doesn't open the first day to me and tell everything, especially for psychological and various disorder. So the music therapist build rapport with the client, and they do a lot of initial assessment. That is, even before they start their therapy, they do the assessment. We have a structured assessment. We teach our students a lot about the initial assessment. And my colleagues here, the two assistant professors, Mrs. Boneshwari and Ms. Janita Karen, are very particular that they do the initial assessment, the lengthy one, before they ever start their therapy. So the initial assessment has different components. They do the assessment of the clinical aspect of the person. How is his BP? How is his oxygen level? And so we train our students in this, and we assess their musical profile. Are they trained musically? What is their preference? Whether they like melodic music, whether they like rhythmic music, or they like spiritual, they like instrumental music. So very elaborate assessment of their musical profile is done even before we set our goals. So we set our goal based on the objective or based on what the referring clinician asks us. Maybe a psychiatrist can ask to improve the cooperation for a person whom he is treating. So based on that and based on the initial assessment, the intervention is planned and it is implemented stepwise. We evaluate on the progress each step, and we don't terminate as such. We train also the family members, and we also train the patient, the person or the client to take up the music therapy practices along with them so that they follow it up. There are a lot of them who come back to us, and the follow-up is an ongoing process. So this is just an overview of how a music therapy process happens. And this gives you an answer how we could tailor the intervention based on a particular client and based on the requirement what the client actually wants. Yes. As I told that the music therapy sessions are not a single one. It is a mixer of one or more of the music therapy methods, which depends on what the client wants and what is the resources, what the client is capable of doing. So that is how a session is designed. So before we start that, I'll just give a very brief understanding of the 4 important music therapy methods which have their own objective and their own outcome. So a receptive listening experience is one which is normally given to patients who are not in a situation to actively participate. Maybe for a patient who has just undergone a surgery, a post-operative patient has severe pain, may take up a listening experience, a receptive listening experience. So this listening of music helps to reduce their pain. So it gives an emotional support to them, and they have a sense of belonging. In a post-operative ward, when no one is there, when the music therapist is along with them, hand-holding and giving, it gives them a sense of belonging, and it helps them to cope up the situation. So this increases their sense of manageability. An improvisational experience is one. The client is given the freedom to improvise along with the music therapist in his own way. He need not repeat what is exactly done by the music therapist. They can improvise on how they feel, which is possible to them, and that freedom on that space is given to them. So once you give that, they can express their emotion. Actually, the person communicates non-verbally. When there is a free flow of emotion, it gives me a feeling of meaningfulness. When I pile up my emotion, when there is no avenue for me to express myself, when this improvisational experience, when this space gives me that, and when there is someone there to understand that, it creates meaningfulness to me. A recreative experience is one. There is an already existing musical experience is recreated either by singing or playing instrument along with the therapist. It is done as a group session or an individual session. So while doing along with a group session, it brings you to that moment. You become aware of where you are. It is the now moment. And so you are oriented to reality. You are able to comprehend what is happening, and now it improves your comprehensibility. So you can gradually see all the three aspects of sense of coherence. My life is meaningful, my life is understandable, and I know what it is built by the different types of or different methods of music therapy. The other one, the creative one, where the therapist helps the client to create a musical piece. He helps them, he guides them. There is songwriting and discussion. I will tell a context about that. So here also you are having a chance to express yourself. And just imagine if you are able to write a song and there is a tune for it, it is sung. It gives you a self-confidence. It gives you a lot of achievement. So this builds your self-esteem, and finally a sense of coherence is achieved. So all four methods have their own way of their own outcome, and we use a combination of each one of them. So having seen what we do in different aspects, let's see how we bring in everything together. And music therapy interventions, as I told you, is used not in one setting. It is used actually across the healthcare spectrum. You start from preventive. You improve their quality of life, improve their wellness. It is curative where you help them to adhere to lifestyle modification as a rehabilitative process, and finally as a palliative care. Yes, where it is used, all these levels, it is used in different settings. It can be used in hospitals in various departments and specialties. It is used in a rural health setup, as I told, as a part of community service, and also in hospices and special care settings. So this elaborate application or referral areas of music therapy is there before us. And we at the School of Music Therapy were able to get a very, very good cooperation from our clinicians in the hospital and also the administrators. And we get a lot of referral from them. And after the success of one, it goes by word of mouth to the other and the other. And from various departments, we get referrals, and I would share a few of them with you now. So, as I always like to say, our music therapy practices start even before the birth of a baby up to end of life. So first, I would like to start with the gynecology and obstetric. That is, we have a special program called Garbh Sanskar, where you look at the wellness of pregnant mother and the baby in utero. Actually, in our Indian mythology, we have a story for the one goddess who was in his mother's womb, hearing the mother's preach. No, there is a lot of story about it. And we have Garbh Sanskar for pregnant women. We have music therapy practices where they sing together. You can see here, they sing together along with them, which helps to establish their wellness, and also they feel like a community. And there are music therapy processes to increase lactation. One very special unit here, setting or practice here, I would like to tell is our music therapy intervention during episiotomy. Hope you might have heard this. Episiotomy is a process, or it is a clinical procedure which is given once a mother delivers, or exactly when the mother delivers, there is an incision made on the genitalia to deliver the baby. So it is such a painful process. Every woman would say that it is the most painful experience in her whole life. And the whole labor ward itself is a very stressful environment. It is a rebirth, not only for one life, it is a birth for two lives. It's a rebirth for the mother, and it's a place where a new life emerges. So our music therapists go in, and they are along with the gynecologist, the obstetrician, they go and meet the pregnant women before delivery. And during delivery, they stand along with them during episiotomy. They handhold them. They teach them chanting and humming. So this, apart from psychological support, it helps them to breathe deeply. A lot of benefits of deep breathing was told by Professor Meena Ramanathan. So that helps them to maintain their balance, and also psychologically they get the support during labor. So what happened after we started giving this music therapy practice during episiotomy, the very nice feedback we got was, apart from these women, the gynecologist and obstetrician who were actually attending the labor, they felt good. So what they said, they started calling our music therapist every time when a labor was happening. It might be in the evening, it might be in midnight, it might be on week holidays. They will call them, you please come here and be here. And they were feeling also good. So music therapy is not only for the patient, it is also for the caregivers, it is also for the therapist. So you can feel how good it would feel for a music therapist when you are there during labor and you are supporting such a stressful event. So this is a very, very proud initiative of us. Nowhere in the world music therapy is given during episiotomy. It was done as a study, and we have our evidences which are being published as article in literature. And the other one in pediatric care, you would wonder what music therapy can be given for a neonate in the preterm ward. So it is there we give for the mother and also for the baby during intravenous injection, for the wellness and cooperation for injection, and also for the mother, starting from preterm neonatal intensive care unit, and then during immunization during pediatrics and pediatric procedures, we give music therapy. And it is also one of the best practice for us. We have a core pediatrician who work along with us, who actually teaches our music therapy students on which area of pediatrics they can work. Yes, I would also take one more minute, few minutes to explain this. In lung functions or pulmonology, chronic obstructive lung disease is a chronic disease. It doesn't stop, it comes year together, and the patient worsens year by year. the oxygen to your lung is very less, and seasonally you get a lot of wheeze and you're not able to properly breathe. So when a person is not able to properly breathe, you can understand how much of turmoil they face. So normally a pulmonologist or a clinician, apart from medicine, give them the instrument you can see here, which is called as a vitalogram or a spirogram. It has few balloons and they are instructed to blow them as much as possible so that this physical work improves to open up their lungs. So lungs after the branches end up with small balloons which are called as alveoli. So the alveoli of these patients are actually collapsed. So we as doctors ask them to blow these vitalograms to open the balloon. So we found out that very interestingly, a mouth organ, which cost a few, not maybe $1 or a pound, here few hundred rupees, a mouth organ, using a mouth organ makes you blow like that, improves your lung functions. So just imagine, I had my mother-in-law who was a patient of chronic obstructive pulmonary disease. She used to sit and blow this and all the children will come and make fun of her. So it is very stressful for a patient to blow this, but instead our music therapist created few rhythms or few tunes, in which the mouth organ can be played, and they even trained them to do so. So you can see them playing the mouth organ along with them. We gave them few mouth organs, and when they were admitted in the hospital, the music therapist used to go and give session where the therapist and the client will make tunes out of these mouth organs. And we also observed that the lung functions, the vital capacity, the peak expiratory flow is the maximum flow which you could do, all improved because of using this mouth organ equally in compared to the vitalometer. And one benefit was, along with the improvement in lung volume, it is also the feeling of the patient, the quality of life of the patient. You just imagine, I learn a tune and I start playing mouth organ. It hears sweet to my own self. So I really feel like taking the mouth organ and playing it again and again at home. Hopefully my partner and my children don't object. So it really improves the well-being of the patient along with improving his lung functions. So this is also a very innovative practice from our School of Music Therapy, and it was done as a complete thesis, and the evidences are being published in literature. We give music therapy for patients who are terminally ill in intensive care units. You can see him singing a spiritual song along with the therapist. Yes. This is also very unique. Music therapy is given for rehabilitation. Actually, neurorehabilitation has a lot of physiotherapy practices. So physiotherapists are called upon by neurologists and neurosurgeons in order to ask the patient to do the movements along with the physiotherapist. So normally these patients, because of the pain, they are very reluctant. They don't open up. They don't do with the physiotherapist. So when our music therapist initially went to the department, there was a patient with tuberculosis of the brain, and he had paraplegia. So all the 4 limbs was paralyzed. He was very depressed and did not cooperate to the physiotherapist at all. So she was using very small instrument, and when she started to do, he opened up and he started to cooperate. And along with the music therapist, the physiotherapist was able to get an entry and the physiotherapy session started. Then we started getting call from the physiotherapist. So when he wanted to go to the neurorehabilitation, he was very scared to go all alone. So he will call us. So come along with us and please be there along with us when we do the physiotherapy session. And all these things gave us a lot of a sense of accomplishment and sense of good feeling that you really care for someone who are in need. Yes, music therapy in cardiology is also a special event. So in cardiology, it is actually a lifestyle modification. Our cardiologist himself is an adjunct faculty for us. So we give before cardiac surgery in order to reduce the anxiety of the patient, and it is given post-operatively to overcome the pain. We don't stop with this. It is very, very interesting to see a music therapist being allowed along with the cardiology team to enter into the cath lab. You must know that a cath lab or a cardiothoracic surgery ward is such a high profile center for any institution. Not even a normal general surgeon could go there. It is a it is a super specialty, but a music therapist is allowed to go there. You can see her holding the hand of the patient who's undergoing the cardiac bypass surgery and a coronary angiogram being done. You must be knowing that a coronary angiogram is done when the patient is conscious. They don't get general anesthesia. They are only given spinal or local anesthesia. And you can understand the magnitude of stress and fear someone would have when they undergo angiogram. Not even that, when someone tells you have a block in your heart, I am gone that day. No, even how many ever you tell me my confidence level goes down. And no one can come along with the patient into the cardiology theater. But our music therapist has gained that much of confidence with the cardiologist and the team that she is allowed to go inside. She stays there, and before going, she talks with them. She assesses his preferences and profile, and she decide what music she has to give to him. And she is along with the patient throughout the surgery, which is such a wonderful experience that we could do something good for them. And this is also a very important area where we work. Yes. As I told cardiologist, the head of the psychiatry department is an adjunct faculty of our School of Music Therapy. And here I would mention that he was one of the person who started the music medicine unit more than a decade ago. He has a strong belief in music, and his picture was used here to show how music acts and the brain-body connections. So all of us learned from him, the head of the psychiatry department, who's a renowned psychiatrist on the brain-body connections and the mind-body connections. They call us to give adjunct therapy for patients whom they treat along with them. They actually run a study there. Here, patients who are in alcohol de-addiction therapies are undergoing music therapy along with that. Can I have some few more minutes?
Ma'am, we are already close to
Yes,
the
sir.
end, and we would want
Yes.
some time for them to have some questions.
Yes, sir, sure.
Yes,
So we
please,
work
ma'am.
with the caretakers in the, along with the patients, we work with the caretakers. We help procedural support to reduce pain and improve cooperation. And finally, as it is told that we have educational goals to build music therapists and also for our health professional students. And we have music therapists working along with special need children. Here, our assistant professor, Ms. Janita Karen, is specialized in that, and she is doing her PhD in this. We work with the children to improve their performance, and we also empower the teachers to use music in their education. We take music to field and to school. We help music for the underprivileged, and hence, the transgenders and the elderly community and the geriatric care. So this is how we work across the various horizons, across the various settings, and various roads lead towards salutogenesis, the modern music therapy, traditional practices, and mainstream healthcare. We have given our contact. We are happy and welcome any queries and collaborations from you. And with lots of gratitude for to the Star Society for the opportunity given. Thanks a lot. Thank you. I'll stop sharing, sir.
Thank you, Dr. Sobana. So I will go back to Margaret, and I am not going to do my part of the last presentation because we're already late. So if there are any questions, I think it would be more efficient to use the time for that.
Okay, thank you so much to Professor Ananda, Professor Meena, and Professor Sobana for really, really interesting presentations. Thank you. Are there any questions or any points of clarification that people would like to raise? So just to remind you, you can either put up the hand like that if you'd like to ask a question, or you can put a question in the chat. And while we're waiting for some of the responses, Professor Ananda, I was just really lucky to have had 3 months in Canada. And I was so interested in what you were saying about East meeting West and you bringing them together, because there in Canada with the indigenous people, they talk about two-eyed seeing and two-eared hearing. And what they mean is the one eye is the indigenous lens and the other eye is the Western scientific kind of lens of seeing things, and likewise with the hearing. And I thought it reminded me a little bit of what you were saying. Yes. Yeah.
You know, when we look through one eye, we only see one dimension. With the other eye, the second dimension, and with both, you see the third dimension.
Yes, indeed. Yeah. And Prof. Meena, I've got a question for you while we're waiting for some others to come in. It was really, really interesting to hear about this yoga therapy, and it seems to focus very much on the individuals and, you know, the body, the mind, and the spirit, and so on. But you did also talk about social well-being, and then briefly mentioned group activities and the sense of belonging, and then with the autistic children, the bond with the siblings and so on. But I was wondering, could you say anything more about this social well-being, how the yoga therapy contributes to the social?
So initially, all these, this target population that we are talking about, they have this hesitant to come out or meet people because of, the problems that they are having. And more than that, we make fun of them without even knowing, when a special child walks down, say a Down syndrome baby is walking down on the road, automatically our head turns there. And, we look at them at and very strangely, not like how we address everybody. So within them, they know very well that they are different. And, within them, they are suffocating. And that actually helps, that truly makes that, they bound themselves and they don't want to face people. They don't want to talk to people. They don't want to, that is the main problem because of which they become attention seeking. So after yoga, they slowly gain the confidence. Yes, I am an individual, and they start accepting, like, I have these issues, but that doesn't matter. I can do whatever I can do, because they become more confident. And, like a child who had to be dragged into a class, now they can go up on stage and perform. And they easily, go and talk to people who were very shy to even look eye to eye, with other people. Now they can look eye to eye and they can talk, they can correspond very well. And these are a few things that I'm telling you about.
Yes, that's wonderful. Thank you. Well, we've got a couple more questions. So the first one is, how do you get around the regulatory bodies in the Western medical world? Not all are so open to holistic medicine and treatments.
That is a tough one. That is a tough one. And I think we have to play with the local community. We have to see how we can find the right people who can speak the right words at the right place in our own communities to make it happen. I think, regulatory bodies are always going to only look at the letter and not the spirit. And this is why I think it takes individuals who are bridges. Even in India, it's not easy. But because I'm also a medical doctor, I'm also a yoga therapist, I can speak with both the communities and bring them together. So in each country, I think you have to find people who can be living bridges, who can speak across the borders and, take it sans frontiers. I think that's what we need to do.
Thank you. And then another question, I'm sure this affects many of us. I'm intrigued to know how funding has been enabled for this. Yeah,
Well,
living in the UK, this person
yeah.
says, yeah,
we
everything
are
seems to be a business model. Yeah.
we are very fortunate that being a privately funded university, our management has understood the importance of this type of initiative. So you need a management which is benevolent. You need people who are willing to look at quality rather than quantity, and people who are looking at a humanistic model of healthcare and not a diseased model of a diseased business model of disease care. I think it's humanistic model of healthcare, not a business model of disease care. So I think we just have to find there are good people in every country. There are good people in every place, and we just have to find the right people who can do it. But
what did you do to your management to convert them?
Well, I think, they just saw the impact we had on the society, and they realized that currency is not always that which can be counted. And they realized currency of goodwill is very important. So our management in our university, they get a lot of goodwill currency to their accounts. And I think that really makes them support us a lot.
Fantastic. And sort of following up from that, what is the level of acceptance of yoga and music therapy into the mainstream healthcare planning in India?
It's much stronger in the last decade because the government we have had gives a lot of support to the Indian systems of medicine and Ayush. So they are pushing very strongly, practices like yoga, naturopathy, Unani, homeopathy, the whole Ayush. It is being funded, it is being pushed. There's much more money, there's political will, there's societal acceptance. Yes, music therapy has never really had that direct support. But what we are trying to do is under the Ayush say that music therapy is also part of that. So one M we have to add someplace into that AYUSH.
Fantastic. Yeah. Are there any other questions or comments before we wind up?
There was one comment in the at the beginning where they talked about salutogenesis strategies for pathogenic purpose. There was a question, I think Craig Becker had left.
Yes, that's correct. He's gone
yeah.
though. Yeah.
Yeah. What I would say there is, different people are placed in different places to do the work they are to do in their life. That is ikigai. That is what we call dharma. That is the sense of purpose. And because we are in a healthcare institution that is looking at disease, we are trying to change the paradigm from inside. So most of what we have described today will be in a healthcare setting where we are bringing a change in paradigm. So we do a lot of work in community for primordial and primary prevention. But it's very tough to know what you have prevented. That is the biggest thing. Whereas in a hospital, you see what the person was, what they are, and you can see what they can be. And hence, case studies, documented research, more than 200 publications, and about 52 projects we have completed, which are all there on the web.
Yes, thank you. I mean, it really is an incredible record that you've achieved at your institute. And thank you to all three of the presenters for giving us this wide picture of, the range of what your therapies achieve. And also helping us to see how it links to salutogenesis, and particularly the three aspects of the sense of coherence, so that it is coherent therapy complementary, integrative, rather than just an alternative. So thank you all so much for doing this. And I'm sure many of us will be going and checking your website to find out more about this and looking at some of your publications. And we're extremely grateful to you, three of you in your different time zones, for coming and joining us and presenting to us. So thank you all.
I would just like to acknowledge the presence of our team here, Bhuvaneshwari Ramesh, who's assistant professor in the music therapy. Maybe you can just say hi so they know what you look like. You saw her in the photos.
Mm-hmm.
Hello, everyone. Thank
Hello.
you so much for inviting us to present our work. It means a lot. Thank you.
And Janita Karen, who is also assistant professor music therapy.
Hello, Janita.
Hello, nice meeting you. It's a great initiative from your side, and we are very happy to be a part of this and for the future endeavors also.
Yeah, thank you.
Dr. Balaji, who like me is a medical doctor and yoga therapist.
Hello, Dr. Balaji.
Namaste, namaste, madam. Thank you for having us here and giving us a wonderful exposure to the world. Thank you.
We have a young and vibrant team, and we hope that we'll all contribute towards salutogenesis worldwide.
Yeah, thank you.
Cooperation always.
Yeah, thank you. And I'd like to just give the final word to Georg Bauer, our leader of the Global
thanks
Work Group.
also from my side for this wonderful overview of your work. I mean, it's really impressive how you really implement this WHO strategy of reorienting health services to become more health promoting. I think this is actually what you're really very powerfully doing with a very broad impact, evidently. And I just would like also certainly to thank Margaret for really preparing this webinar and guiding us through so well, and also Anya and Martin, who have been involved in the preparations, besides certainly the speakers who shared their knowledge today. And the last point I would like to make, please be reminded that we will have upcoming the 7th International Conference on Salutogenesis in June 19 and 20. I heard that unfortunately you are all somehow busy during that time in India, but hopefully other people here attending the webinar still might decide to come, because there you will see that certainly salutogenesis can be applied to the healthcare context, but also to many different other fields such as design, education, migrants, refugees, crisis situation, war, and so on. So I think salutogenesis is really a powerful concept also beyond healthcare. And this is what you can really learn a lot about when you join our conference. So thanks again, Margaret, for your wonderful moderation.
Thank you. Thank you all. Bye-bye.
Bye.